Hello and welcome to this presentation on COVID-19 and vaccines. My name is Nora Perry. I work for Providence Brain and Spine Institute as a regional program manager, and I have the pleasure today of interviewing Dr. Kyle Smoot. Dr. Smoot is an MS neurologist and the director of our Providence Outpatient MS Clinic. So without further ado, I will let Dr. Smoot tell us the agenda for today.
All right, well, thank you, Nora, for moderating the program, and thank you for the participants for tuning in today in terms of getting an update on COVID-19, and specifically we'll talk about the 3 vaccines that are currently available in the United States, as well as our recommendations and the National MS Society's recommendations for the vaccines, and then also for the patients that are on disease-modifying therapy, discussing the timing of when to receive the vaccine.
Great, thank you for that overview. It's a lot of great information we'll get into. Though before we start, I think many in the audience might receive their care at our MS clinic, and so it seems like a good opportunity to get an update on our clinic operations. Can you tell us more about that?
Yeah, so as the pandemic is improving, we would like to start seeing more patients in the clinic. Most of us have been already vaccinated, and we feel that Providence has done a great job of screening people before coming in to the clinic. So we are still offering virtual visits, but especially if you haven't been in the clinic for a while, I encourage you to change your appointment to in-person so that we're able to do an exam. It's also important to make sure you're staying up to date with your health maintenance, the laboratory tests that potentially may be required depending on which medication you're on, as well as the imaging.
Great, thank you for that. And now to get into our content about COVID-19. Can you start us off with some updates in how COVID-19 affects people with MS?
Yes, so we've presented this in previous presentations, and really, to be honest, not much has changed. Fortunately, we have been able to continue to gain information on patients that have experienced COVID-19, and obviously the numbers continue to increase. And so this is part of a registry in North America and called the COVID-MS registry. And patients have access to this information. You can go to this website and look at these exact same numbers that I'm presenting today. And so as of March 10th, there was over 2,300 reported cases of MS patients developing COVID-19. Again, that number is obviously higher. This database works on clinicians reporting their patients, so obviously it takes some time to do so. But in general, the patients that have not done well are typically older patients. You can see that the average age of patients who have died is 62 years old, roughly, compared to those in their mid-40s. And then most of the patients had progressive MS, and usually those patients are requiring some assistance to walk or not able to walk. And one interesting statistic is that patients who are not able to walk were 25 times more likely to die than those that were ambulatory or able to walk. And some other takeaway points is that over 90% of these patients who died had other medical conditions, so typically cardiovascular disease, so heart disease. Males were more likely to have a severe course of COVID-19, as well as Blacks. And then a lot of people have questions about their disease-modifying therapy. Now, in theory, those treatments alter the immune system and may make one more susceptible to infections, and particularly COVID-19. And that's still potentially the case, although we've not seen that patients that are on disease-modifying therapy have a more severe outcome than those that are not on disease-modifying therapy. So, and actually a third of the patients that died were not on any treatment for their MS, which is quite common, especially since most of the patients were had progressive disease and they were also older. One thing to make note that that has been discovered is that actually patients that were treated with steroids in the prior 2 months of developing COVID-19 had a more severe course or potentially were more likely to die due to COVID. We use steroids periodically for the treatment of relapses. And again, those can be very beneficial to help reduce symptoms and expedite recovery. But it's also very important to make sure that you need those steroids before moving forward, because that may be a risk factor for a more severe course of COVID, because it does alter the immune system.
Thanks, Dr. Smoot. So when we move now from the topic of COVID in people with MS to the topic of vaccines, there were some vaccine guidelines, general guidelines, published recently. Can you tell us a little bit more about those?
Yes, just to start off with general recommendations concerning vaccines. So these were published about 1.5 years ago by the American Academy of Neurology in support with 2 major MS organizations. And the bottom line is that MS patients should move forward with getting their vaccines. So here, this is specifically was talking about the flu vaccine, and we'll talk about different types of vaccines here in a little bit. But there is no evidence that by receiving a vaccine that's going to trigger MS or potentially trigger a relapse. And there is some evidence that potentially vaccines may be somewhat protective of developing MS, and I've listed a few here in this slide, including the tetanus vaccine. It is possible, though, that MS medications, specifically disease-modifying therapies, may have an effect on vaccines. So potentially the medication may make the vaccine not as effective, and that has been seen in some clinical trials, although even though the response is slightly limited, it should be enough still to protect one from developing whatever they're being vaccinated against. So again, it's still recommended that patients that maybe are on certain medications, even though the effect may be blunted, that they still receive the vaccine. For most patients that are on disease-modifying therapy, you should not receive a live vaccine, particularly patients that are on our oral therapy or IV infusions. And I think it's important, if you have questions in general about vaccines, is to talk to your treating clinician.
That is some really great overall guidance about vaccination for people with MS from a trusted source. So thanks for taking us through that. And you did allude to the fact that there are different types of vaccines. Can you explain some of those types?
Yes, so it's very similar to what we presented a couple months ago, but just a refresher for maybe those that weren't able to join that program. There are many different types, and we're most familiar with the first 2. So there are live vaccines, which is a weakened version of potentially a virus or a bacteria, and I list some examples. Fortunately, there are not very many live vaccines currently, but maybe the one that we're most familiar with is the measles, mumps, and rubella vaccine, which hopefully you were vaccinated with as a child. And now that there is a vaccine to prevent chickenpox, and that is also live, and that's a relatively new vaccine. So again, people that have alterations in their immune system, again, the patients that are particularly taking an oral therapy or an infusion, should not have live vaccines. Probably those that are taking medications like Copaxone or one of our interferons, let's say such as Avonex or Rebif, live vaccines are likely okay to receive. And then there are inactivated vaccines. So most people get the flu vaccine yearly, and that's an example of an inactivated vaccine. Although there is a nasal formulation of the flu vaccine, and that is actually live, so that would not be recommended again in certain MS patients on treatment. And this vaccine is not as effective year to year, so frequently, or in the situation with the flu, you have to be vaccinated every year, and also strains of the flu change, and that's another reason why the vaccine is given yearly. And then more recently are the messenger RNA vaccines. These are developed sort of mimicking the virus, or in the case of COVID-19, the spike protein. It's not exactly the same as the spike protein, and there's no way that you would develop COVID-19 by receiving the vaccine. So if you would just inject the messenger RNA into someone, the body will destroy that right away. So the messenger RNA is protected by, let's say, a sort of a casing of fat, and then that's the cells take up that, and then the cells break that down, and then the messenger RNA is exposed, and then the cells then take the code, and then they make a protein that looks very similar to the COVID-19 spike protein. And then the cells destroy the messenger RNA. And so it's almost like if I have a secret and I give you, if I write it down and I give it to you, and then you know the information and then you tear it up. So it's exactly what our body's doing. And then now it has made the protein, and then our immune system hasn't seen that protein before if you haven't been exposed to COVID-19. And so then your immune system mounts a response so that in case if you're exposed to COVID-19, then your immune system can take care of that, and so then you won't get infected with the virus. And so that's the underlying concept with messenger RNA vaccines, and these vaccines are relatively new, but they've also been studied for many years, and so we're very fortunate that we have the science that was sort of looking into this before COVID-19. And I understand that some people are concerned about getting the vaccines because they are relatively new, but fortunately we had the foundation prior to this pandemic. And there's been other conditions where these type of vaccines have been looked into, including for the Zika virus. Some of you know that messenger RNA vaccine has also been studied in what we call a mouse model of multiple sclerosis, and it was shown to be very effective at altering the immune system and particularly delaying the progression of possibly MS in the mouse model. And so it's very exciting because then the next step would be to study this obviously in people to see if it has a positive impact. So I think outside of COVID-19, we're going to continue to hear more about these messenger RNA vaccines. The other types of vaccines, and again, this is not all the vaccines that are available, are what we call vector vaccines. And we have the Johnson & Johnson vaccine, which they have a vaccine that's using the same technology to treat a condition called Ebola. And this is sort of one step before RNA. So the DNA is then converted to an RNA in the cell, and then the cell then converts the RNA into the protein, again, that looks like the spike protein for COVID-19. Instead of it being sort of wrapped up in a fatty particle, it's wrapped up into an adenovirus. Adenoviruses are very common. They can cause the common cold. They can cause sometimes gastrointestinal viruses. But this adenovirus is not an activated or live virus. So it's been altered. So there's no way that you would also get the adenovirus. And so this is an example of the DNA vaccine then of the Johnson & Johnson, and then there's also the AstraZeneca vaccine, which is quite similar, although that's not yet approved in the US. And then there is protein-based vaccines where, again, they take the spike protein, they alter it a little bit, and then the thought is you're able just to inject that directly into someone, and then your immune system makes an adequate response. And the results have been somewhat mixed right now, unfortunately, and I think there is still a trial going on evaluating the efficacy of this type of vaccine.
Thank you for helping us understand all those types, Dr. Smoot, and very applicable right now because 3 vaccines are currently approved in the US for emergency use authorization to protect against COVID-19. Can you tell us a little bit more about those 3?
Yeah, so obviously there are 3. The Pfizer vaccine was the first to be approved. And then the Moderna vaccine shortly followed that. And then as of early March, we have a 3rd one, which is the Johnson & Johnson vaccine. And so both the Pfizer and the Moderna vaccines are examples of the messenger RNA vaccine, and both require 2 injections. The Pfizer, the second injection is given roughly 3 weeks after the first injection. With the Moderna, it's a little bit longer. It's roughly 4 weeks or a month after that second injection. There is some protection after the first injection, maybe more robust for the Moderna compared to the Pfizer, although again, you have to be very cautious in comparing the efficacy when they're not studied in the same clinical trial. But they both have been shown to be significantly effective in reducing symptomatic COVID-19 infections. And in the Moderna trial, there were no severe cases of COVID-19 or deaths due to the infection. So if you want to obtain more information, currently the New England Journal of Medicine, and these references are here on the bottom, their COVID information is open access during this pandemic. And so you can read the articles about concerning the clinical trials. They also have some nice videos that are roughly 2 to 3 minutes explaining the virus and the results from the trials as well. And then the Johnson & Johnson vaccine was just approved earlier this month. Again, it's the DNA vaccine, so a little bit different than the other 2. And again, over 40,000 adults were enrolled or participated in the trial. The advantage to this vaccine is that it's only 1 injection is only required, and it can be stored more easily compared to the Pfizer and the Moderna vaccines. And it was shown to reduce severe illness by about moderate to severe illness, about 70%. And again, there were no deaths seen in the vaccine group. So I know that some patients have asked questions about, well, this doesn't look to be as effective as the Pfizer and Moderna, but again, you have to be very cautious about comparing because this trial was done a little bit later. Obviously, there have been some variants or mutations that have evolved over time, and also their outcome measures were just a little bit different in terms of how they looked at infections. So the bottom line is that if for right now you really don't have much of a choice in terms of which vaccine, but I would not pass up one vaccine just because you're waiting for another vaccine.
Great. So now that we understand what's available, can you let us know a little bit more about the side effects of some of these vaccines?
Yeah, so most common is going to be some pain at the site of the injection. So this may last for a day or 2, especially with the first injection. And that may be it. You may have some mild muscle aching or feel a little bit tired or have a headache. And it is possible that you could have more of a reaction at the time of the injection, and that's why all patients have to wait for at least 15 minutes after they have each injection. And if you have certain medical conditions, they'll ask you to wait even longer, up to 30 minutes. After the side effects are potentially more prominent after the second injection, and I'm talking about the Pfizer and the Moderna. So what I recommend to patients is to make sure that you're well hydrated and as well rested as you can be prior to going into that second injection. And don't have too much planned in case you do have some side effects for the rest of the day or the following day, because you might have some more muscle aching and fatigue. I've received both my injections. And I received Moderna, and after the second injection, I felt fine. But towards the afternoon, I started to develop some muscle aching and felt pretty tired. So I ended up going to bed quite early that night. So it just, I think it's important just to be prepared and not, again, have too much planned the following day in case you don't feel well. It's also recommended that you do not pre-medicate with anything prior to the injection. So if you do start to experience some muscle aching or maybe a headache and feeling really tired, then you can take things like Tylenol or ibuprofen or Aleve to help with some of those side effects. But the concern is if you take that before you have the injection, then possibly you may blunt your immune response to it. And for MS patients, you may also notice that your symptoms may be a little bit worse after each injection, because again, your body is trying to potentially fight off something. It may raise your body temperature a little bit, and as many of you know, when your body temperature goes up, you do potentially experience some more symptoms. So it's not, again, going to trigger a relapse. These symptoms should last for maybe 24 or 48 hours. However, if they are persisting, again, obviously you need to let your clinician know as well.
Thank you, Dr. Smoot. It's a great overview, and so you give some expectations of what people might experience and some great guidance. So next, can we talk a little bit more about guidance? What is the MS Society and what is the Providence MS Center recommending to patients with MS given these vaccines?
Yeah, so it's a great question, and the National MS Society is recommending that MS patients move forward with receiving the vaccine. We've had many MS patients already have the vaccine, and again, no major issues, just sort of what I discussed previously about the most common side effects. And obviously there are some high-risk groups, and fortunately we have moved forward with older patients getting the vaccine, or at least have been eligible for the last month or two, but also particularly Blacks and Hispanics should move forward with getting the vaccine because those groups seem to be more affected with COVID-19 and potentially have a more severe disease course. The National MS Society's recommendation is that any of the three vaccines are safe to receive, and I have included a link to the National MS Society's website. At Providence, for most of the clinicians here would also agree or support that recommendation. However, if you want to move forward with the Johnson & Johnson vaccine, just check in with your clinician to make sure that it is okay. But overall, all three vaccines look to be safe in MS patients.
Thanks. And so you did mention that folks are eligible in some cases at this time. And so can you give us a little more information about when people can get vaccinated?
Yeah, so I'll start off with talking about citizens of the state of Oregon. Unfortunately, Oregon has had a relatively slow rollout. As of today, I think we rank about 36th out of 50 in terms of the number of people that are vaccinated. And hopefully that will improve over time. And I know for many people it has been frustrating to schedule an appointment. And we'll talk a little bit about how to schedule an appointment, or at least to get on a list. So currently we're in phase 1B. And we're in group 5, which are individuals that are 65 and older. We were hoping that MS patients would be in group 6, at least those that are 45 to 65, but unfortunately, unfortunately, that's not the case. So the state of Oregon only included patients that are at high risk for developing COVID-19. The CDC also has another list including possible conditions of high risk, and Oregon decided to hold off on including that list, unlike Washington State, which I'll talk about a little bit further. So the conditions on the right, if you have one of these conditions and you're between the ages of 45 and 64, then you would be potentially eligible to receive the vaccine really no later than March 29th. Now, there are actually several counties that have been able to move this forward, I think starting next week. Unfortunately, Multnomah, Washington, and Clackamas County are not included in that list. Most of the counties are in eastern Oregon and a little bit south west of here, including Lynn County, I think is actually included on that list. So for people that live in some of the counties outside of Portland, may be eligible starting next week. Group 7 is going to be patients people between the ages of 18 and 44, again with one of the medical conditions that's listed over on the right. And again, you can go to the CDC website and they will list these conditions as well. And then phase 2 is really everyone else. So if you're 35 and you have MS and no other medical conditions, then you should be eligible no later than May 1st. The big question is yes, you may be eligible, but will you be able to schedule an appointment? And a lot of that's going to depend on the supply of the vaccine. So how to schedule an appointment? So you need to go to the covidvaccine.oregon.gov website. And I think the best thing to do is to sign up to receive a notification when you're eligible. And then they also have another tool where you just click on a button that says "Let's get started," and they will ask you questions. And if you're eligible, you might be able to schedule an appointment at that time. I've done that with a few of my patients, but usually there's no appointments available. So encourage people to try to do this early in the week and early each day to see if any appointments have been released. There are some local pharmacies that are now providing vaccines. And I've included some websites here. The first one is the Albertsons affiliated pharmacies. Walgreens and Walmart are also providing vaccines. So again, you can go to these websites. And just heard earlier today that Providence will be starting to have their own vaccine clinics really at the sites where they've been doing testing for COVID-19. Again, you would still need an appointment, so stay tuned for that, especially if you have a Providence primary care clinician, but that will likely start later this month or early April. So the number of sites are increasing. Most patients that live in Multnomah, Washington, or Clackamas County will go to the Oregon Convention Center, and it's quite a smooth operation. So even if you have some difficulties walking, they're very accommodating there, and usually move patients through quite quickly. The airport is also another option, although potentially you might have to wait a little bit longer there. So I wouldn't be discouraged by going to the Oregon Convention Center. I know it's a large place, but it is quite well organized. And then Washington State's plan, they're a little bit further than Oregon. And again, the website is below, and they have a nice diagram of their phases. And they really, they just moved into what they call phase 1B, tier 2. And from what I can decipher on their website is that I think that patients with MS could probably start to become vaccinated either now or potentially by the end of this month. They include these conditions that are high risk that I showed you on the previous slide, but also other conditions that potentially put one at higher risk, and neurological conditions are part of that, as well as if you're on medications that may alter the immune system. So sort of hoping that MS patients in Washington State will be eligible no later than the end of this month.
Thanks for all of that information, Dr. Smoot. Clearly, there are a lot of considerations from when folks are eligible to how to make an appointment. And there is an additional consideration for people with MS. So can you help us understand what is the timing of getting a vaccine for a person with MS who might be taking a disease-modifying therapy?
Yeah, this has been the challenging part of not only trying to get a vaccine, but figuring out the timing, and I think also part of this, patients have to be flexible as these dates continue to change, as well as potentially some suggestions concerning timing. And the bottom line is that the key is for you to get vaccinated. So I was on a conference call with people that make up the committee on the National MS Society Vaccine Committee, and they provided guidelines concerning timing, but the take-home message was if the opportunity comes to get vaccinated. We're not concerned about safety. It's more potentially if you get the vaccine too close to some of your infusions, particularly infusion medication, that it may not be as effective. So just reviewing the medications, really for all injectable therapies. So this is going to be things like Copaxone and the interferons, so Betaseron, Avonex, Rebif, and Plegridy, is to try to get the vaccine on a non-injection day, just because of the potential flu-like side effects you can have with both of them. But if if it's your injection day and that's the only day you can get an appointment, well, then potentially delaying your injection by a day. But you can always discuss that with your clinician. And then all the oral therapies except for Mavenclad. So this is going to include things like Tecfidera, Vumerity, Aubagio, and Gilenya and its cousins Mavenclad and Zimposia. Anytime is fine. You don't need to hold a dose. Kesimpta, which is relatively new, which is an injection that is done monthly. Recommend that you wait 2 to 4 weeks after your Kesimpta injection, and then go ahead and get your vaccine. And then after it's been maybe at minimum 2 weeks to 4 weeks, then you can go ahead and restart your Kesimpta. So it's likely that you will miss a dose of your Kesimpta. I guess if you have the Johnson & Johnson vaccine, maybe your Kesimpta would be delayed a little bit. Both Lemtrada and Mavenclad, we recommend you wait at least 4 weeks after your treatment before getting the vaccine. And then Ocrevus and Rituxan, these are just very similar IV infusion medications. It is recommended that you wait at least 6 to 8 weeks prior to receiving the messenger RNA vaccine, because that is going to require 2 shots. So you want to make sure that your last shot is at least 2 weeks before your Ocrevus. However, with the Johnson & Johnson vaccine, if your clinician feels that it's safe for you to move forward with that, it's a little bit easier. Just make sure it's at least 2 to 4 weeks before your Ocrevus. And then if your Ocrevus, let's say, scheduled next month, well, then we'd recommend you at least wait 4 weeks after your infusion before receiving the COVID-19 vaccine. So I know there's a lot of information in there, and if you have questions about the timing, again, please reach out to your clinician. And there's some flexibility, especially I think for patients that have been on Ocrevus for a couple of years and are doing well. If we need to delay your infusion by a few weeks or a month so that you can get the vaccine, then I think that it's safe to do so. And again, we really want patients to get vaccinated so they don't develop the virus. Tysabri, pretty much you're telling patients not obviously to get on the day of their infusion. Maybe you might not want to do it the day before or the day after, but again, no major concerns about the timing with Tysabri. And then for steroids, if you're being treated with IV Solu-Medrol, I'll probably recommend that you wait a few days after your, after your final steroid dose, not vaccine dose, before starting or receiving the vaccine.
Thanks so much, Dr. Smoot, for your time and for this wealth of information. Are there any parting words you have for our audience today?
Yeah, so one thing that I do want to mention is that this week we just started a vaccine trial, or at least looking at how patients are responding to the vaccine. So as I mentioned at the beginning, there is some concern that maybe certain medications may blunt or attenuate the vaccine response. This is a study for people that are 18 to 55 years of age, and we're looking at patients that are on medications such as ocrelizumab, which is Ocrevus, Gilenya, Tysabri, or Tecfidera or Vumerity. It's a relatively small trial, so there are going to be 10 patients in each group. And so once a patient receives the vaccine, then there'll be 4 blood draws in terms of following the vaccine response in this patient population. So if you're interested, you can contact Francesca, who's one of our study coordinators, and her phone number is below. And she can sort of talk to you about, she can inform you about the details of the clinical trial and the timing of the blood draws. But we feel like this is a very important trial, because obviously we don't know, potentially we all may need a booster of the vaccine, especially if the strains continue to change over time. And I'm sure there are other places that are also looking at this response to the COVID vaccine as well. And I guess my final word is to get vaccinated. I know that some people have some reluctance to move forward with a vaccine. Last time we did a presentation was back in January. We discussed some myths concerning the vaccine, so you can always go back to that program. But in reality is that we need to move forward with getting vaccinated as fast as possible to prevent the virus from mutating. Otherwise, we're starting all over again. And it's really estimated that probably 90% of adults in the state of Oregon need to get vaccinated to have herd immunity, because right now children aren't being vaccinated. So, you see numbers around 60 and 70%, but that's the overall population. And right now, people 18 or younger are not eligible for the vaccine. So, if you have concerns about the vaccine, you should feel comfortable raising those concerns or questions to your primary care clinician or to your neurologist, so we can have a discussion about what the concerns are. So we all want to make sure that you stay protected and don't develop COVID-19. Unfortunately, we've all had some patients that have died due to COVID-19, and I have some patients that still have some residual symptoms from the infection. So there's just a lot of unknown. While most people have a mild infection and recover quite quickly with no residual, there's just no way of predicting.
Thank you, Dr. Smoot, and for that advocacy and this education that you offer to our patients and MS community. And you referenced our prior presentation. Both that one and this will be available on our Providence Brain Academy YouTube page. So they will be there for reference in future. And thanks for that parting message. Get vaccinated.
All right. Well, thanks, Nora, for arranging the program today.